Top 8 Best Ways to Stop Frequent Urination at Night. Nocturia. Frequent nighttime urination, also known as nocturia, can be a frustrating and exhausting problem. Waking up multiple times a night to use the bathroom not only disrupts sleep, but also affects daily energy levels and overall quality of life. Nocturia can be caused by various factors, including fluid retention, hormonal changes, certain medications, or underlying health conditions like diabetes or prostate issues. Fortunately, there are several practical ways to manage and reduce these nighttime interruptions, allowing for deeper, more restorative sleep. This article explores the top 8 strategies to address nocturia, from lifestyle adjustments to dietary changes, providing actionable tips for a better night's rest. 1. Limit fluids before bedtime. One of the most straightforward ways to combat nocturia is by reducing fluid intake in the hours leading up to bedtime. Consuming large amounts of liquids, especially diuretics like coffee, tea, and alcohol, can significantly increase urine production at night. Experts recommend cutting back on fluids at least 2 to 3 hours before going to bed. Instead, focus on hydrating earlier in the day to ensure adequate fluid intake without overloading the bladder in the evening. This practice can help reduce the frequency of nighttime trips to the bathroom, making it easier to enjoy uninterrupted sleep. For individuals experiencing hormonal changes, such as decreased antidiuretic hormone ADH levels, or those with medical conditions like diabetes or heart disease, addressing fluid intake timing can make a noticeable difference. Incorporating additional habits, like elevating the legs during the day to reduce fluid retention, wearing compression stockings, and avoiding stimulants before bedtime, can further alleviate symptoms. If these adjustments do not provide relief, consulting a healthcare provider to explore potential medication options, such as diuretics or desmopressin, may be necessary. 2. Elevate legs before bed. Elevating the legs before bed is a simple yet highly effective strategy to reduce frequent nighttime urination, particularly for individuals who experience fluid retention in the lower extremities. Throughout the day, prolonged periods of sitting or standing often cause fluids to accumulate in the legs due to gravity, a problem that is more pronounced in those with conditions such as chronic venous insufficiency, heart failure, or sedentary lifestyles. When lying down at night, this retained fluid re-enters the bloodstream, increasing the workload on the kidneys and leading to more urine production. By elevating the legs above heart level for 1 to 2 hours before bedtime, you allow the body to redistribute and process the excess fluid earlier, significantly decreasing the need for nighttime bathroom trips. His method also reduces swelling and discomfort, improving overall circulation and helping prevent complications such as deep vein thrombosis and leg cramps. Medical experts have highlighted the benefits of leg elevation, particularly for older adults and those with heart or kidney issues, as it alleviates fluid pooling and supports better sleep quality. For optimal results, using pillows or a reclining chair to comfortably elevate the legs while engaging in relaxing activities such as reading or meditating can prepare both the body and mind for restful sleep. Research supports this practice, showing it can enhance sleep continuity and overall health by reducing the burden on the bladder during the night, making it a valuable tool for anyone struggling with nocturia. 3. Double voiding, ensuring a restful night's sleep. Double voiding is a highly effective and straightforward technique to help manage frequent nighttime urination or nocturia. This practice involves a 2-step approach to ensure the bladder is thoroughly emptied before going to bed. First, you urinate as usual and then wait a few moments before attempting to urinate again. The second attempt often helps release any remaining urine that the bladder may not have expelled fully the first time. This ensures that the bladder is as empty as possible, reducing the likelihood of waking up during the night with the urge to urinate. One of the primary benefits of double voiding is its ability to address residual urine, a common issue especially in older adults or individuals with bladder conditions. Residual urine refers to the small amount of urine left in the bladder after urination, which can create the sensation of needing to urinate again soon after. By adopting the double voiding technique, this issue is minimized, leading to a more restful and uninterrupted night of sleep. Double voiding is particularly beneficial for individuals dealing with conditions like benign prostatic hyperplasia (BPH), urinary tract infections (UTIs), or age-related weakening of bladder muscles. These conditions can interfere with the bladder's ability to fully empty, contributing to frequent urges to urinate. Research and clinical observations have shown that double voiding can enhance bladder function and improve nighttime bladder control, making it a recommended practice for those struggling with nocturia. Incorporating double voiding into your nightly routine is simple and requires no special tools or medications. To maximize its effectiveness, pair it with other complementary strategies like reducing fluid intake in the evening or elevating your legs before bed to decrease fluid buildup. Over time, consistent use of double voiding can lead to noticeable improvements in sleep quality, helping you wake up feeling more rested and less fatigued. This technique is a valuable and easy-to-adopt habit for anyone seeking to minimize nocturnal disruptions and achieve better bladder management. 4. Adjust your diet, nourishing your bladder for better sleep. Diet plays a pivotal role in managing nocturia and improving sleep quality. The foods and beverages consumed, particularly in the hours leading up to bedtime, can significantly influence bladder activity and overall comfort during the night. Certain foods and drinks are known to irritate the bladder, increasing the frequency and urgency of urination. Adjusting your diet by identifying and minimizing these triggers can help reduce nighttime disruptions. Key irritants to watch out for include spicy foods, acidic fruits such as oranges and tomatoes, and artificial sweeteners, all of which can exacerbate bladder sensitivity. Additionally, beverages like caffeine and alcohol act as diuretics, promoting increased urine production and potentially leading to frequent nighttime trips to the bathroom. To avoid these effects, it's wise to limit or eliminate their consumption, particularly in the late afternoon and evening. Foods with high water content, such as watermelon and cucumbers, can also contribute to nocturia when eaten close to bedtime. While these foods are hydrating and nutritious, consuming them earlier in the day helps to minimize their impact on nighttime urination. Instead, focus on incorporating bladder-friendly foods such as whole grains, lean proteins, and vegetables known for their anti-inflammatory properties. These options support overall urinary health and help maintain a balance that minimizes bladder irritation. For those looking to make sustainable changes, keeping a food diary can be an invaluable tool. Tracking daily food and beverage intake can help identify personal triggers and patterns, offering insights into which adjustments are most effective. Over time, this approach empowers individuals to tailor their diet to better support bladder health and reduce nocturnal disruptions. Incorporating an anti-inflammatory diet has been shown to promote bladder health. Whole grains, leafy greens, and foods rich in omega-3 fatty acids are particularly beneficial. Studies have also highlighted the importance of maintaining a healthy weight, as excess body weight can exert additional pressure on the bladder, contributing to more frequent urination. By making thoughtful dietary choices, you can address one of the root causes of nocturia and take a significant step toward more restful and uninterrupted sleep. 5. Train your bladder, building control over urinary patterns. Bladder training is a powerful technique for managing nocturia by increasing the bladder's capacity to hold urine and reducing the frequency of nighttime urination. This method involves gradually extending the intervals between trips to the bathroom during the day, which conditions the bladder to retain urine for longer periods. Over time, this practice can help improve bladder control and minimize nocturnal disruptions. The process starts with small, achievable delays in urination. For instance, if you typically use the bathroom every hour, begin by waiting an additional 10 to 15 minutes before going. Gradually increase the intervals by 5 to 10 minutes over the following days or weeks. By progressively training the bladder, you can encourage it to hold more urine and reduce the urgency to urinate frequently, especially at night. Research shows that bladder training is particularly effective for individuals experiencing nocturia due to conditions such as overactive bladder, OAB, or age-related bladder changes. A study published in the Journal of Urology found that patients who engaged in bladder training experienced a significant reduction in nighttime urination episodes compared to those who did not practice these techniques. Tracking progress is essential for success. Keeping a bladder diary, where you note the timing of urination and any changes in frequency or urgency, can provide valuable insights and motivation. This log helps identify patterns and measure improvements, making it easier to stay consistent with the training routine. Bladder training may take weeks to show significant results, so patience and persistence are key. While practicing this method, it's important to stay hydrated during the day, but limit fluid intake in the hours leading up to bedtime. Combining bladder training with other strategies, such as double voiding before bed and adjusting dietary habits, can amplify its effectiveness. In some cases, working with a healthcare professional or specialist can provide additional support. They may recommend tailored training techniques or complementary therapies to address specific bladder issues. By committing to bladder training, you can regain control over your urinary patterns, reduce nighttime disruptions, and improve your overall quality of life. 6. Check your medications. Understanding the impact on nighttime urination. Medications play a significant role in managing various health conditions, but some can inadvertently contribute to frequent nighttime urination, also known as nocturia. Certain drugs, particularly diuretics, are designed to increase urine production, which can lead to disrupted sleep if taken too late in the day. Diuretics are commonly prescribed for conditions like hypertension, heart failure, and edema, but their timing is crucial to avoid excessive urination at night. If you suspect your medications are causing nocturia, it's important to consult with your healthcare provider rather than altering your regimen independently. A provider can assess whether your current prescription schedule is optimal or whether adjustments could help reduce nighttime symptoms. For instance, taking diuretics earlier in the day allows the body to process and eliminate excess fluids before bedtime, potentially minimizing nocturnal bathroom trips. Other medications, such as corticosteroids, antidepressants, or certain types of sedatives, may also have diuretic effects or influence the bladder's function. Identifying and addressing these potential side effects requires open communication with your doctor. They may suggest alternative medications or therapies that provide the same therapeutic benefits without exacerbating nocturia. In addition to discussing medications, it's helpful to review over-the-counter supplements or remedies you may be using. Some herbal or dietary supplements could have diuretic properties that contribute to frequent urination. Being transparent about all substances you consume ensures a comprehensive evaluation of factors affecting your bladder health. For those who cannot modify their medication schedules or switch to alternatives, healthcare providers may recommend lifestyle adjustments to counteract the effects of these drugs. Techniques like elevating the legs in the evening, reducing fluid intake before bed, and employing bladder training can complement medication management and improve sleep quality. Ultimately, understanding the relationship between your medications and nocturia empowers you to make informed decisions about your health. By working closely with your healthcare provider, you can optimize your treatment plan to support both your medical needs and your ability to enjoy restful, uninterrupted sleep. 7. Stay active during the day, enhancing bladder control and reducing nighttime urination. Physical activity during the day is not only beneficial for overall health, but also plays a crucial role in managing nocturia. Regular exercise helps the body process fluids more efficiently, reducing fluid retention in the lower extremities. This is particularly important because fluids that accumulate in the legs during the day can re-enter the bloodstream when lying down, leading to increased urine production at night. Engaging in moderate physical activity, such as walking, swimming, or cycling, can stimulate circulation and aid in redistributing fluids throughout the body. This reduces the likelihood of nighttime bathroom trips by allowing the body to process and excrete excess fluids during waking hours. Aim for at least 30 minutes of exercise most days to maximize these benefits. In addition to general exercise, incorporating pelvic floor exercises, such as Kegels, can strengthen the muscles that control the bladder. A stronger pelvic floor can help improve bladder control, minimize leakage, and reduce the urgency to urinate frequently. These exercises are particularly effective for individuals experiencing bladder weakness or overactivity. Maintaining an active lifestyle also supports weight management, which is a critical factor in reducing nocturia. Excess body weight places additional pressure on the bladder, contributing to more frequent urination. By staying physically active and managing a healthy weight, you can alleviate this pressure to support bladder health. Moreover, research from the American Urological Association highlights that physically active individuals often experience fewer urinary problems. Exercise promotes better hormone regulation and circulation, both of which are essential for maintaining healthy bladder function. To further optimize the benefits, try incorporating activities that reduce stress, such as yoga or Tai Chi. Stress and anxiety can exacerbate the need to urinate at night, so practices that promote relaxation can complement your efforts to manage nocturia. By staying active during the day and incorporating targeted exercises into your routine, you not only improve bladder health, but also enhance your overall well-being. These habits can significantly reduce the frequency of nighttime urination, allowing for a more restful and uninterrupted night's sleep. 8. Establish a bedtime routine, creating consistency for better sleep. Developing a consistent bedtime routine is a powerful strategy to manage nocturia and improve overall sleep quality. By establishing regular sleep and wake times, you can regulate your body's internal clock, also known as the circadian rhythm. This synchronization helps optimize various bodily functions, including urination, reducing the likelihood of waking up multiple times during the night. A calming pre-sleep routine can also play a significant role in managing nocturia. Engaging in relaxing activities, such as reading a book, taking a warm bath, or practicing deep breathing exercises, can help lower stress levels and prepare your body for restful sleep. Stress and anxiety are known contributors to frequent nighttime urination, as they can stimulate bladder activity. Creating a peaceful atmosphere before bed can minimize these triggers. It's equally important to eliminate stimulating activities before bedtime. Avoid using electronic devices such as smartphones, tablets, or televisions at least an hour before sleeping. The blue light emitted from these screens can suppress melatonin production, a hormone essential for regulating sleep. Instead, dim the lights and engage in activities that promote relaxation. Incorporating mindfulness practices, such as meditation or gentle yoga stretches, can further enhance the quality of your sleep. These practices help calm the mind and body, reducing the urgency to wake up during the night. Additionally, ensure that your sleeping environment is conducive to rest. Keep the room cool, dark, and quiet, and invest in a comfortable mattress and pillows to support uninterrupted sleep. Research from the Cleveland Clinic indicates that individuals who maintain a regular bedtime routine experience fewer sleep disturbances, including nocturia. Consistency is key, so try to stick to your schedule even on weekends. This consistency helps train your body to recognize sleep signals, leading to deeper and more restorative rest. By establishing a structured bedtime routine and prioritizing relaxation before sleep, you create an environment that supports not only your bladder health, but also your overall well-being. Over time, these practices can significantly reduce nighttime bathroom trips, allowing you to wake up feeling refreshed and energized. Managing nocturia is about more than just reducing nighttime trips to the bathroom. It's about reclaiming restful sleep and improving overall well-being. The strategies discussed, from limiting fluid intake before bed to establishing a consistent bedtime routine, emphasize the importance of a holistic approach to addressing frequent urination at night. Each method, whether it's elevating your legs, Double voiding, or making dietary adjustments, plays a vital role in minimizing disruptions and promoting better bladder health. Bladder training and staying physically active empower you to take control over your urinary habits, while checking medication schedules and consulting healthcare providers ensures a tailored approach to your unique needs. Together, these strategies form a comprehensive framework for managing nocturia without relying solely on medical intervention. The lessons here extend beyond nocturia. Prioritizing self-care through regular routines, mindful dietary choices, and physical activity highlights the interconnectedness of health habits. By addressing the root causes and adopting proactive measures, you not only reduce nighttime interruptions, but also enhance your quality of life. Remember, small, consistent steps can lead to significant improvements. Whether you're incorporating these tips into your daily routine or seeking professional advice, every effort contributes to a healthier, more balanced lifestyle. A restful night's sleep isn't just a luxury. It's a cornerstone of good health, and with these actionable insights, it's well within your reach.